So this is going to build off of my video I put up yesterday about being prepared. This is everything in my first aid kit. I've got a spreadsheet. I'll go ahead and make sure there's a link to that so that you guys, if you want to do this yourself, you have a list. I even put Amazon links in there, so that'll just be linked below. This is what I decided I'm going to carry. When I did this 10 years ago, I got a bunch of input from various forums and other people, and I picked and chose what I thought I needed based on that information. So this is not gospel, it's just what I'm doing. So let's go ahead and get started. The first thing you need is a bag. I showed you this yesterday. This one's just LA police gear. Go grab whatever you want. It doesn't need to be a very big one, but just get a nice sturdy bag to go ahead and put everything in. I like having the pockets. It makes organization very easy. And also what I will be doing in this spreadsheet is telling you, I have all of this on there and I have some additional stuff that I chose not to get. You may or may not want it, some of that stuff. When you're building this, make sure you know how to use everything you're putting in here. So if everything here is pretty basic, I think the quick clot and tourniquet and a chest seal, which I'll get into, those are three things that are kind of, you may not be knowledgeable in, so figure it out. You know, quick clot, you're going to use this, the person's going to the hospital. Like, this is a life or death situation. This is not a first aid thing. This is, if I don't do something, they're going to bleed out, so I'm going to hope that this is going to work. And whether I put this in or not, they're ending up in the hospital. So this hopefully stops bleeding. Tourniquet, same thing. You're not going to use this in first aid, but if you're in a situation where you need to apply a tourniquet, that person needs to get to the hospital, needs to get to a doctor immediately. Same thing with a chest seal. That's a big deal. Again, I have that stuff in here specifically because I go to the range a lot, and so there could be instances where I need those things. So that being said, let's get into what I've got here, and we'll go from there. First thing that I have these sterile pads. It's basically a gauze pad. I have them in three sizes: 4-inch, 3-inch, and 2-inch. If you want, go ahead and just get the 4-inch ones because you can always fold them up and make them smaller. So that's one way to save some cost. Make sure when you buy these, you get them individually wrapped. You want them, the sterile ones that are individually wrapped. Do not just buy the loose boxes of any of this stuff. So sterile pads, gauze pads is what I keep calling them. So use these. You're going to use these to patch up basically a wound that's bleeding, not like a little scrape, but something a little bit bigger. Maybe it's a dog bite or something like that. But you'll patch this up and it'll slow the bleeding, hopefully promote some clotting. This is first aid, and sometimes, depending on what happens, this is good enough. To go along with that, you need some tape. So I've got, this is a cloth tape. 3M makes it. It's called Micropore, but this is a good cloth tape. This one is a transparent tape. I think they call this medical tape. It's a little bit different, but it also works. Either of these will work to go ahead and fasten that gauze on, but keep those around. And then this stuff, for the life of it's on my list here, but I can't remember, what is this one called? Anyway, this one is a tape that sticks to itself, basically. It's got kind of a mesh feel to it, and so it's elastic, and if you wrap it around, it'll stick to itself, and it works really well for maintaining some pressure there without being too much. So I've got these three different types of tape that I keep in my bag. The next thing that I have, Band-Aids. I get a little Ziploc baggie. I put an assortment of Band-Aids. I have these butterfly ones for joints. I've got these small ones. This is 2 of them, but I got small Band-Aids and I have the larger ones. You're always going to need them. Just throw a handful in there. You're going to need them. In that bag, I also have this burn gel, because if you get burned, you're going to want this stuff on it. So I keep this stuff all together into just one little baggie, and then put the baggie into this nice bag over here. Next thing that I have are these ACE bandages. I keep 2 of 2 different sizes, so 4 total. I think these are 1.5 inch and 3 inch, something like that. Sprains, or maybe you need to make a splint, or you can find a use for these, but realistically you're probably going to be just using it on like a sprained ankle. So I keep these around. Again, these are all individually packaged. Keep everything individually packaged. Next item that I've got, I have 2 of these Israeli bandages. So what these are, it's essentially a gauze pad attached to one of these ACE bandages. It's more or less what this is, but it's all in one, so you can put it on and tie it up and it works. So I've just got the 2 different sizes here, again, individually packaged. They're good to go. Quick clot. This is a hemostatic agent, so there's Quick Clot and there's a couple of other brands that make it. What this does is it stops arterial bleeding. So, like I said, I keep it because I go to the shooting range. There's a good chance that this is something I might need. This is not really first aid so much as life or death situations. If you are in a situation where you need to use this, that person is going to go to the hospital. You are trying to buy some time with this so that a doctor can fix them up, because chances are you're not a doctor and you don't know what you're doing, but this will buy you some time. This thing's probably $20 or so, so if you don't want it in your first aid kit, I get that. That makes sense. If you're not going to come across this kind of stuff, that makes sense. If you do get it, make sure you learn about it and figure out how to use it. Some of these come in a powder, some of them are on a piece of gauze. It depends on which one you get, but basically if you have an arterial bleed, you're probably not going to be able to stop it, and you can't apply a tourniquet. This could be a good choice to use. You'll open it up, put this powder in there, and it will clot up, if you will, and stop that bleeding. I've been told this stuff kind of burns. Granted, if this is being applied to me, that's going to be the last of my worries. But learn about this if you're going to have it. I think it's a good addition to a kit, especially for anyone who's going to be around firearms, because this is the type of stuff that you might need. But learn about it. I think this is a good addition. They come in packages just like this, and like I said, they come in a couple of different brands, as well as a couple of different types, whether it's powder or already pre-applied to gauze or something like that. So good addition. I keep it around for a specific reason. Instant ice packs. So I just keep a couple of these, 3 or 4 of them in there. Crush them, they'll get cold. You know how they work, that's really all there is to it. Tourniquet. Again, this is more specialty stuff that you may not need. Tourniquets are probably $20. So, if you're building your first aid kit and you're on a budget, you probably aren't going to need the tourniquet, but with what I do, I think this type of stuff is a good idea. And again, if you're watching this, it's probably a good idea too. This one is, who makes this one? A soft T tourniquet. Cat makes a couple. There's a couple of others. You're going to spend around $20. You can practice putting these on loosely on yourself so that you know how to do it. But when you do apply it for real, these need to be very tight. So you need to understand the difference between practice application, which you should get familiar with how to apply a tourniquet if you're going to carry one, and then how to actually apply it. The intent is you're stopping an arterial bleed on like an arm or a leg, and you need to cut off that blood flow. So this thing needs to be really tight. I chose this one specifically because it had the metal windlass, so that you can really twist down on it and stop it. But tourniquet, I think, is a good piece of gear to have. Again, this is something where if you are applying this, you are going to end up taking that person to the hospital. This is not first aid, put this on and then send them on their way. It doesn't work that way. When you do apply these, it's a good idea to put the time that you applied it. Some of them have a little piece of fabric that you can write on. If not, write it, take your Sharpie and write it on the skin of the person, so that EMTs, doctors know when this was applied. Again, I'm not going to go in depth on how to use all this stuff. I'm going to tell you this stuff that's a little bit more specialty. If you choose to carry it, and I think many of you will, you need to learn how to use it properly. And the other point I want to make, I had mentioned you can go ahead and practice applying this on yourself. Knowing how to apply this with one hand, put it on your arm, is a good thing to do. It's not complicated, but it can be awkward to do. And then when you do it, you're obviously not clamping it down. You're going to tie it down, give it maybe a twist just so that you remember I have to twist it, and then push that down. But you will not clamp down when you're practicing. But good idea. This is a chest seal. This is not something you're probably going to have unless you're at the range a lot. And if you do choose to have it, you need to go figure out how to use this before you add it in your bag. Basically, it's a sucking wound where someone can't breathe and they have a hole, in their chest, at their lungs. So you can put this over that hole and it will help them breathe. You need to figure this out. There are fortunately instructions here, but you need to figure out how to do this. Look up videos, get the information before you just add this. This is not something that most people are gonna need or want in their bag, but again, if you're at the range, this is the type of injury that could happen, and this is the type of thing that for $10 and a quick understanding of how it works, you could seriously save someone's life. So for me, this is a good addition. Figure out what your needs are, and again, this is a little bit more specialty. You need to know how it works. I am not a medical professional. I'm not telling you how to use everything in depth, but I'm telling you, you need to learn how to use it if you choose to carry this. Moving on, I already went over, I always have a Sharpie. Use it to write the time you put a tourniquet. Use it to write any information. If you come across someone and they tell you some information that, they have an allergy to something, write it on their forehead, write it on their arm, put information down that's going to be important, or, maybe you just need to take a note about how to get to the next store, whatever it is. It doesn't have to be first aid, but always have a Sharpie or two around. Good thing. Next item, medical shears. These are EMT shears. They cut through, they have little serrations on there, okay? And then the way they're built, they don't flex like a normal scissor would too much. So these things work really well for cutting through clothing or any of the fabric that you'll have. They're really strong, really good. Get a set of these. It's not just regular scissors. These are really good to have around. Tweezers, like I said before, you're gonna end up pulling out splinters and that type of stuff. So these are fine point tweezers. I have 2 of them, but whatever, just have at least 1 pair. You can always use these alcohol prep pads to disinfect them, but keep some tweezers around, they go well. alcohol prep pads. These are basically wet wipes, but they're alcohol, okay? Use it to disinfect. You can use it to disinfect tweezers, your knife, or even an injury, okay? Have these around. Liquid skin. I had put this in because it's a good way to patch up minor cuts and scrapes without really dealing with a bandage, and it works really well. The one thing I found, it seems to evaporate over time, so just check it occasionally. This thing was full when I put it in, and I'm down to about 1/3 of a bottle, and I've never used this. But regardless, this is good to have. I'll end up replacing this and putting a full bottle in there and just going through it later. Neosporin. You need some sort of antibiotic cream. If you're gonna, if you have a dog bite or you have a scrape or something like that where they've opened up the skin, and this is something, it's first aid. You can send, patch them up and send them on their way. Put the Neosporin on. It's not going to hurt anything. Good idea. Always have gloves. Some people are allergic to latex, so I know sometimes I'll refer to these as latex, but they're actually nitrile gloves. I have 2 pair in here. You can get the medical ones, or you probably already have these same type of gloves in your garage for working on your car. So just get some gloves, some nitrile gloves, put a couple pair in there. You don't want to touch someone else's blood if you can avoid it, with your bare skin. So you never know what you're coming across, and it's always a good idea to glove up. So go ahead and do that. Good thing to have. I have these little syringes. These don't have needles on them or anything, but these are basically to go ahead and for irrigation. So we have like bottled water and stuff in the car, so you could go ahead and get some water in here and squirt it on an injury and kind of get some of the dirt off and help clean. So these things come in handy. That's why I keep them in there. I mentioned it before, you need a knife. Keep it good, keep it sharp, keep it in the bag, don't put it anywhere else. I have matches, stormproof matches. Some duct tape, again, to save some space. I went ahead and took this, wrapped it around a business card, and I've got a good amount of duct tape, so it's another good option if I need it. And the last thing I have is first aid guide from the AMA. So you can go through here and it tells you about bites and stings, things to do if you don't know. Basic stuff, how to do CPR, choking, all this type of stuff. So you probably know how to deal with the most basic stuff, but as you get into something like, someone has frostbite. Well, okay, this isn't really a life or death emergency right now. I have a minute, I can go ahead and, okay, this is how I treat it and what I need to do, and this is my next step. So you need to take care of this. I believe they went through, I hope they did. Yes, so the most important thing, they have it up front here. They call it the ABCs. So this is really important. You should always know it and know it by heart. You shouldn't be looking this stuff up. If you come across someone that needs health, you always check 3 things: the airway, the breathing, and the circulation. And you're going to address those things. So make sure they're not choking. Make sure they are indeed breathing. And then make sure that blood is flowing and you stop bleeding. Okay, so take a look at that kind of thing. That's kind of, you need to figure out these basics. So that's what's in my first aid bag that I keep in my car. Like I said in my other video, I made a handful of these. I put one in my car, one in my wife's car. Just keep it in your car. Don't take it out. Keep it there. You never know when you're going to need it. The other thing I'd like to add, I was watching another channel, Mr. Guns and Gear. I'll link to the video I'm talking about as well. He made a video yesterday as well. And I guess he had a very exciting weekend, much worse than mine was. He ended up saving someone's life, not because he had a first aid kit, but because he had training. So that's the other thing to touch on is you should have some form of training. I'm not an EMT, I'm not a doctor. I know basic first aid stuff, and after what happened with this weekend, as well as watching his video, which was much more serious, to recap, basically, someone attacked a neighbor of his. The neighbor fell off his motorcycle and split open his head and had some serious issues. So he went over how he dealt with that, and fortunately he wasn't an EMT, but he has a lot more medical experience than me and probably most of you. You should know how to deal with some of these things. You know, you need to make sure they're breathing and not choking. And he went over that in his video, and his training told him how to do that. It told him how to position him in, something like a recovery position. It's basically the fetal position. So get some training. At the very minimum, get training on how to use what you have in here. If you can afford it and if you have the time, spend a day or a weekend and get some better training. Whether it's wilderness medicine training or something more advanced like an abbreviated EMT training. There are various, we'll just call them first aid training classes available. So take one of those if you can, but at the bare minimum, know how to use everything that's in your first aid kit. All right? Anyway, we'll get back to some of the other content that I know some of you guys are looking forward to. But in the meantime, I hope that this is useful for at least a few of you, and we'll do this again another day.